All right. So my bacteria of choice was Borrelia Burgdorferi. We've heard about it in class a lot, mostly when talking about how it takes a super long time to replicate, but we'll get more into that later on. So let's get started. So let's start with the taxonomy. The phylum it belongs to is Sporcatales. No, Spirochaetes. Yes, the order is Spirocatales. The family it belongs to is Spirocatalaceae. I think I'm pronouncing that right. The genus Borrelia and the species, more specifically, Borrelia burgdorferi. All right. So the morphology. The shape of it, or the length of it, is composed of about 5 to 10 loose spiral coils. It's helical shaped, much like DNA. It's very slender and thin, and they have relatively long cells. The dimensions of it is 10 to 30 micrometers in length and about 0.18 to 0.25 micrometers in diameter. So pictured is just kind of, you can see how they're helical, and just how many coils you can see in the whole thing. Their habitat, virulence, and transmission. So first, for the growth and isolation, they grow best in about 32 degrees Celsius. That's not negative, that's just a dash. So about 32 degrees Celsius in a microaerophilic environment. What micro meaning they want less air than atmospheric air, oxygen, and aerophilic meaning they need air to grow. So just they need air, but just less air than you find in your regular atmospheric oxygen levels. Virulence and transmission. So the way they adhere is they use their OMP, which is outer membrane proteins, and that's what they adhere to host cells with. The two identified outer membrane proteins that they use are protein BB0405 and BB0406. And so the way they work is once they adhere, they don't secrete toxins. They just worked to an inflammation of our immune system. So it's a survival over trying to just do destruction to the host. And the way after surviving and replicating, that's how they start to work rather than just going in and destroying things. So, and their motility prevents against phagocytosis because they're coiled, and most of them have filaments on both, flagella on both ends of the coil. It allows them to move in both directions, and so that allows them to survive easier. And it survives off manganese, which is interesting because our body is primarily composed of iron because it's what our blood is made of, partially. And so this goes later in my talk about treatment options. Is one thing I'm trying to look at is how can we starve it of manganese to try to kill off the bacteria. So that's just an interesting fact about it. The 3 stages of Lyme disease. So we talked about the bacteria, Borrelia burgdorferi, but that causes the disease Lyme disease. And that wasn't discovered until the 80s. So stage 1 is usually see it within 3 to 32 days after your tick bite. So you'll get a bullseye rash, and that could present itself right away, or it could present itself 32 days later. Then you'll start to feel fatigue, chills, feverish, headache, muscle and joint aches, swollen lymph nodes, and all those are symptoms of the flu. So that's another issue is the number is reported to be around 20,000 cases a year in the United States. However, that number could be a lot higher because this disease could be mistaken for the common flu. Stage 2, you'll see bacteria spreads to the various sites of the body, so not just the bite site. So you may develop more rashes all around your body. You may develop some more severe headaches, pain and swelling of the joints, heart palpitations, and dizziness. And if it spreads to the spinal cord, then you're going to see meningitis. So stage 3, you're going to see months to years after your tick bite. And if it's gone undiagnosed, then with no treatment at all, you're going to have really bad arthritis, and it's going to affect your larger joints like your hips and your elbows and your knees. A secondary consequence is like cardiac and neurological issues that you will see, shooting pains in your hands and your Shooting pains and numbness in your hands, that's associated with arthritis. And memory problems, that's like when it affects your brain. So the history of Lyme disease. So in the 1900s, the early 1900s, there were reported reports of sickness in Europe associated with tick bites. They didn't know what bacteria was causing it or really much about it. They just know that you get bitten with a tick, later you get sick. In 1975, they called it juvenile rheumatoid arthritis, still not knowing what was what. That was a new thing that was identified as. In 1982, Spirocatalis was identified in the midgut of black-legged ticks, and they named it Borrelia Burgdorferi, and that's named after the gentleman who discovered it. So in 1984, Borrelia Burgdorferi was isolated from the site in the blood of someone with a bullseye rash on them, and that's how they tied it to a tick bite. And the most common right now in 2021, it is known as the most common tick-borne infection in the United States, with more than 20,000 infected a year. And that number definitely is up to speculation, because when looking more into it, you'll see some places report 20,000, some places report 25, and you'll even see possibility of 30,000 a year. So it's a serious issue. So how does it cause Lyme disease? So you're going to see in the next slide, well, there you go. You're going to see how it's enzymatic cycle. So you'll see how the infected tick right here has babies. Those babies are called nymphs. Those nymphs transfer the bacteria to the secondary hosts back and forth when they bite. And then those nymphs get infected with Borrelia burgdorferi. They can hold that bacteria in their midgut. They transfer it to the incidental hosts, including dogs and humans like us. Those ticks grow up, become adults. They transfer it to the deer, which is the reservoir incompetent host. And they just keep on going in a circle. They grow up, they develop more eggs. Those eggs hatch into larvae. Those larvae live in the midguts of rats or on the side of rats, and then grow up to be infected ticks again. And it's a cycle that just keeps on repeating itself over and over and over. So the specific risk groups. Well, this is what I could think about. Do you like going on a hike? Do you have an animal that likes to run in tall wooded grass? Do you like to visit Lyme, Connecticut, where it was discovered, and take long walks in grassy fields? Then Borrelia burgdorferi is for you. So all those things are ways that you can get infected with a tick bite. But in all reality, the way to really check it out and avoid it is just to check for tick bites. Every time you go on a hike, every time you play in the grass with shorts on, check for tick bites. And they mostly see this bacteria, or specifically Lyme disease, in 5 to 9-year-olds, which is common because those are the age groups that you see playing in the grass a lot, playing outside, exploring. So let's keep on going. Prevention. I wrote it into 2 different preventions. Tentative prevention would be to use bug spray, wash your pets regularly, inspect for ticks. More absolute prevention would just to be stay inside your room, lock your doors, don't even think of going on hikes. Never get a dog, never pet a dog, never move into an apartment with no access to a yard, get an office job with no outdoor interaction. I mean, it seems a little extreme, but that's one way to absolutely prevent yourself from never getting bit by a tick and never contracting this bacteria. So treatments. There has been 3 most heard of treatments for this bacteria. Early one was in 2002. It was introduced and taken down in the same year. It had severe side effects, and it required to get 3 shots over 12 months, over a 12-month period. And it was only for the ages of 15 to 70-year-olds. And the thing was, it didn't have an immunity time, so it could help you for a year, 2 years, or maybe less. And that was taken off because of severe side effects. The second one was Lyme Prep, and that was developed at the University of Massachusetts Medical School. It's a single defensive antibody, which limits the amount of side effects. You get immunity the same day, and it could be coming as early as 2022 for treatment options. And the third one was VLA15, and it's a vaccine, and it's currently in development. And I wrote the name of the company who's developing. They're a biochemical company. And the cool thing about this is you could get it as young as 5 years old. The antibiotic, tetracycline, fights against bacterial infections. So if you get bit and they identify it, it can fight against bacterial infections in your skin, intestines, respiratory tract, urinary tract, genitals, and lymph nodes. So all areas of infection. And that's everything about Borrelia Burgdorferi. Those are my references. Reference number one is actually the paper that it was written in the 1982 by I cannot pronounce his name. But yeah, thank you.